Welcome to our 10th annual Excellence in Healthcare. I'm Marnie Nesher, president of the Central New York Business Journal. Now's your time to sit down in a comfortable chair with family and friends and join us as we take you through our Excellence in Healthcare Awards. We are excited to continue our tradition of recognizing and celebrating healthcare providers from all over Central New York. And here we are, a year later, still amid the pandemic and still bringing you this great event virtually. And even though we will not get to see you in person, I hope that after you hear each honoree's story, you will feel like you know them a little better. These people who are making a difference in our community, they are on the front line working with people face to face every day. So it goes without saying that it is more important than ever to recognize and honor these healthcare heroes and incredible individuals. BHG has been the presenting sponsor of Excellence in Healthcare for 10 years. Founded in 2001, this company has grown from 3 employees to more than 1,000. BHG has been named one of the best places to work in Central New York for 9 years in a row. They rank on Inc. 5000, named a best workplace for millennials by Fortune magazine. And this year, BHG is celebrating their 20th anniversary. Congratulations and thank you for all that you do in our community. Now I'd like to introduce you to Chris Panabianco, Chief Marketing Officer of BHG, to say a few words.
Thank you, Marnie, and thank you everyone for joining us virtually as we celebrate the critical role that healthcare professionals play in Central New York. I'm Chris Panabianco, Chief Marketing Officer at BHG, and it's my honor to be here with you as we celebrate this important milestone. Welcome to the 10th Annual Excellence in Healthcare Awards. This year in particular is special. In addition to being the title sponsor since the event's inception, BHG is also celebrating its 20th anniversary. Since 2001, BHG has provided over $9 billion in financial solutions and worked with over 110,000 borrowers, making it the nation's leading provider of unsecured business and personal loans. Our business was founded to serve the financial needs of healthcare professionals, and we are honored to recognize the impact that our honorees make in our community. We hope you enjoy the program.
Thank you, Chris. Now let me take a moment to acknowledge and thank our sponsors. I want to personally thank our presenting sponsor, BHG, for recognizing the importance of spotlighting healthcare professionals in our community. Excellence in healthcare would not be possible without all our sponsors. So a big applause for presenting sponsor BHG, our platinum sponsor, Nescentia Health.
Hello, I'm Kate Rolfe, President and CEO of Nescentia Health. Congratulations to this year's Excellence in Healthcare awardees. You have all shown selfless dedication in your fields during such unprecedented times, and these awards represent the recognition with sincere gratitude that you deserve. I wish to extend a personal congratulations and appreciation to the winner of the Outstanding Healthcare Executive Award, Andrea Lazarick Laquay, Nescentia Health's Chief Clinical Officer, a truly inspirational leader with whom I've had the honor and pleasure of working with every day. Thank you, Andrea, and every award winner for your commitment and service.
And thank you to our gold sponsors. Thank you to our silver sponsors this evening. Thank you to 325 Productions, Biz Events, and of course the Central New York Business Journal, who promotes this event in print, digital, and social media. And you can read more about excellence in healthcare in the next edition of the Central New York Business Journal. Now let's get to our awards presentation.
It is my distinct pleasure today to welcome Dr. Indu Gupta, Onondaga County's Health Commissioner. Last year, I introduced her as a recipient of the A. John Marola Lifetime Achievement Award given by the Central New York Business Journal and Bankers Healthcare Group. Dr. Gupta has been a very busy woman over the past year. Aside from administering to all the various duties of the Department of Health, she has been dealing with multiple issues surrounding COVID-19. Today, Dr. Gupta is here to provide us with an update on the status of COVID-19 in our community. Please welcome Dr. Indu Gupta.
Thank you, Dr. Marola. Good evening. Congratulations to all the recipients of the awards today, and especially to Nancy Page, recipient of the John Marola Lifetime Achievement Award. All of you are embodiment of selfless service to the community during this COVID-19 pandemic, the worst pandemic of the century. This pandemic has negatively impacted every aspect of our lives, from physical and emotional well-being to economic health of every community, small or large, throughout the world. There are no doors or barriers to keep this virus out of our lives. This virus is smart, manipulative, fierce, and resilient. Could humans, the most developed species, outsmart this virus by calculating and predicting every step of this virus? Yes, logically I can say that. With the tools available to us in the form of data, science, modeling, forecasting, and ultimately preparation, we can act preemptively and defeat this virus. But have we done that yet? History will be the judge. Throughout 2020, we saw the rage of SARS-CoV-2 virus causing COVID-19 disease, harming health of many. Virus's strategic trajectory was very effective because, unlike human psyche, it does not discriminate for age, race, ethnicity, gender, sexual orientation, geography, nationality, language, disability, and economic background, to name a few. It mutates to survive and becomes stronger and more dangerous. By sticking to its core value, this virus has caused irreversible damage to the society, from disease, death, and despair. Unfortunately, the initial human and societal response to this pandemic was not smooth and cohesive either at the national or international level. However, it was not the same at the local level. The local response, led by Onondaga County, with the health department leading the way, was swift, measured, based on data and science, with laser focus to protect everyone's health by collaborating with everyone. And yes, health of community is the most important pillar of its existence. Without good health, there is no workforce and hence no economy. So after the first case of COVID-19 disease was reported on March 16, 2020 in Onondaga County, we saw significant fluctuations in the number of new cases throughout the year, with its peak in January of 2021. Testing, tracing, case investigation, and contact tracing remained very effective tools. Initial lockdowns, strict mask wearing in public, hand washing, physical distancing helped tremendously. As more treatment became available, it started to further positively change the trajectory of the disease, and more lives were saved. And then came the most awaited remedy in December of 2020 in the form of first COVID-19 vaccine. It gave us hope that we can now see the end of this pandemic in the near future. First Pfizer, followed by Moderna, and soon after, Johnson & Johnson COVID-19 vaccines became available to every eligible American 18 and older, and Pfizer to 12 years and older. With plenty of vaccine flowing in the community, life beyond pandemic appeared within our reach. New COVID-19 cases started to decline, along with the dramatic decline in the death. We experienced firsthand that human perseverance prevailed, and science was able to find life-saving solution in a record-breaking time frame. What a great accomplishment of the century, a big relief and elated feeling for all of us. But soon, we started to encounter changing human behavior due to misinformation and politics. Few started to question even the existence of COVID-19 disease and legitimacy of vaccines. Social media and constant conversation in the mainstream media has given this misinformation a bigger platform. We have had fair share of denials and vaccine hesitancy in our community as well, resulting in resurgence of Delta variant and the high community transmission. Increased hospitalizations and need for critical care is now quite prevalent among unvaccinated individuals right here in our community. Once again, COVID-19 is taking toll on human life. all of this was and is preventable. So at present, 65% of our community members are fully vaccinated. With the emergence of variants, we are seeing firsthand the negative impact of Delta variant. Children under age of 12 are being affected by this highly contagious and transmissible variant. Why? Because many adults who are eligible to get COVID-19 vaccine have not yet taken steps to get vaccinated, which would certainly protect these young ones who yet are not eligible to make their choice. All of this has left us with mixed results, with lingering negative impact of ongoing COVID-19 pandemic. Suddenly, the end of pandemic does not appear to be within our reach for now, a setback for all of us. However, these setbacks should not be a downer, rather should make us resilient. I believe challenges exist so we can overcome them by reassessment, reorganizing, changing strategies, and recalibrating with persistence. What role can each of us play in changing the trajectory of virus? It could be promoting and getting a flu vaccine along with your COVID-19 vaccine, whether it is first or third or booster dose. So I'm very hopeful that testing, tracing, masks, physical distancing, hand washing, and continued vaccination efforts in our community will keep us on the path for us to reach that day when the pandemic will be spoken in the past tense. Thank you and stay safe.
Our first award this evening is Excellence in Medicine. This award is presented to Dr. David Heisig. Dr. Heisig is a board-certified internal medicine and gastroenterology. As the medical director of PACE CNY, Dr. Heisig oversees all the clinical operations of this community-based program and manages the day-to-day care of more than 600 PACE CNY program participants each year. Please welcome Medical Director Dr. David Heisig.
Good evening. My name is David Heisig, and I am the Medical Director of PACE CNY, the Program of All-Inclusive Care for the Elderly. It is an honor to be given this award by the Business Journal of Central New York, and it was an honor to be nominated by Loretto and by PACE CNY. It has been a very difficult 20 months in healthcare due to the COVID-19 pandemic. My career has spanned approximately 40 years, and my internship actually began at the height of the AIDS epidemic. It was a very disconcerting time. Now, nearly 40 years later, we're dealing with a global pandemic, COVID-19. We've passed a grim milestone recently. We have actually lost as many Americans to the COVID-19 global pandemic as we had in the flu epidemic of 1918. It's a sad time. It is my fervent hope and prayer as a practicing physician that we as a community can come together and put truth above misinformation and unite to be able to bring this incredible global pandemic under control and restore some normalcy. Once again, thank you to the Business Journal of Central New York. I am very, very appreciative of this award.
Our next award this evening is Excellence in Nursing, presented to Tiffany Shaver. Tiffany began her health career in the military as an operating room OR nurse. Since she donned her first scrubs more than 30 years ago, Tiffany has maintained her focus on surgical services, advancing from clinical roles to managerial positions at major hospitals in New York State. Please welcome Tiffany Shaver.
Good evening. I would like to thank the Central New York Business Journal for the recognition of healthcare members of our community. I would also like to thank those who nominated me. I am humbled to be presented the Excellence in Nursing Award. As COVID-related hospital admissions rose in Central New York, hospitals scrutinized inpatient bed capacity. Specialized departments such as surgical services had to urgently shift operational plans to help inpatient units meet the clinical care needs of COVID-19 positive patients. Focused on identifying a methodology to provide staff assistance to inpatient units while continuing necessary surgical interventions, a multidisciplinary team developed a plan to implement the medically necessary, time-sensitive prioritization tool. Developed by a team at the University of Chicago, this tool empowers providers to make patient-specific, clinically driven decisions regarding if and when to schedule a patient's elective surgery during peaks in COVID prevalence. The appropriate elective surgical procedures were safely deferred to a later date, thus decreasing the total number of surgeries being performed. The reduction in surgical volume enabled approximately 40 surgical services staff members to assist other hospital departments. I am grateful for the team of medical providers, to include the leadership of Doctors Falcone, Santos, and Wormuth, who guided the Department of Surgical Services through safe continuation of surgery. I'd like to specifically thank the inpatient surgical services leaders who supported the staff through multiple operational day-to-day changes throughout 2021. Anne, Megan, Gretchen, Christine, PJ, Chris, Jody, Matt, Melinda, Heath, Peter, Shannon, Dalen, Jess, Lynn, Aubrey, Corey, Janine, Jenny, Adam, Ramo, and Sam, thank you. I'd like to also express my eternal gratitude to the staff members for their commitment to the health of our community. And to my husband, Eric, thank you for your unwavering support.
Our next award this evening is Excellence in Surgery. This award is presented to Dr. Zandonzo, cardiac surgeon at St. Joseph's Health. Dr. Zhou was born in a small town near Shanghai, China. At the age of 16, he was accepted to Shanghai Medical University and had the opportunity to work in cardiac surgery program. He moved to the U.S. in 1989 and pursued a PhD in cardiovascular physiology from University of Wisconsin-Madison and completed his training in cardiothoracic surgery from SUNY Buffalo in 2002. Dr. Zhou has completed over 5,000 open-heart surgeries. He says he not only saved numerous lives, but learned much about life. Please welcome Dr. Zandonzo.
Good evening. It is a great honor to accept this award. I would like to thank the Central New York Business Journal and the BHG for this opportunity. I would like to thank the people from St. Joseph Hospital who have supported our team over the years. From the administration to our colleagues, our anesthesia team, cardiologists, physician assistants, nurse practitioners, perfusionists, ICU and floor nurses, respiratory and physical therapists, and speech therapists, pharmacists, and the surgical technicians. This award belongs to our excellent team, including past and present members. Open heart surgery is a big operation by any standard. In most hospitals, sternotomy is the way to do the surgery, which means to crack the chest open. Our team started using modern technologies such as Da Vinci robot, peripheral cannulation with vacuum-assisted venous drainage, new nutting technology, and advanced surgical instruments about 15 years ago. Many of the heart surgeries nowadays are done in our hospital through a 2 to 3 inch incision between the ribs. Most of our patients benefit from an easier recovery and a shorter hospitalization. Using the minimally invasive approach, the full recovery period can be reduced from 3 to 4 months to less than 1 month. This is especially beneficial for elderly patients and those with multiple comorbidities. In addition, these new technologies allow us to design a hybrid approach using stenting and minimally invasive coronary bypass to reduce the risk of the traditional open heart surgery by sternotomy. The outcomes have been excellent. Our program has been consistently ranked as one of the top quality programs in the nation for many years. We're also one of the 11 centers in the country listed as mitral valve surgery reference centers by the American Heart Association among about 1,000 hospitals performing open heart surgery. Last but not least, I would like to thank my family for their almost unconditional support for my long working hours and unpredictable surgical schedule. Thank you again.
Tonight's Excellence in Veterinary Medicine Award is presented to Dr. Annette Otis, owner and medical director of Stillwater's Veterinary Care. Dr. Otis says take time and spend it with your loved ones. You never know how long you get with them. Dr. Otis started Stillwater Veterinary Care in the fall of 2017 so that pets can pass peacefully with dignity in the comfort of their own home, surrounded by their family. She was the first person in the greater Syracuse area to receive certification in veterinary, hospice, and palliative care. Please welcome Dr. Annette Otis.
Good evening. I'm Dr. Annette Otis. I'm the founder of Stillwater's Veterinary Care. We are a service that is dedicated to providing compassionate and peaceful passings for pets in the comfort of their own home, surrounded by their families. Also, we do offer some hospice and palliative care medical services to pets in their homes so that they can be where they're most comfortable and reduce their perception of getting medical care. I started this service in 2017 because I just felt like every time I had to say goodbye to a pet in the clinic, it wasn't peaceful, and it was unfamiliar for the pets and their families often, and it just really was not the dignified way to say goodbye to our beloved pets. So I started this service so that they can be at home where they're happiest and most comfortable. I want to truly thank the families that nominated me for this award. I'm always completely touched by their care and love for their pets, and how they have kept them going through illness and how they have found the strength to help them say goodbye at the end. And I really take a lot of strength from that doing this job and helping them at this time. I know how hard it is for me when it's my turn, and I just want to be there for other people when it's their turn. The last gift that we get to give our pet family is just to let them go with peace and dignity in the comfort of their own homes, and remember them in our hearts and keep them alive in our minds. I graduated from veterinary school at Cornell in 2005. I did a rotating internship in Virginia, and I went into emergency medicine. I did emergency medicine for my entire career, and I just really stepped back and had to think about when we say goodbye to pets, especially in emergency, that it really isn't the most peaceful process, and that we could do a better job of that. I have always probably wanted to be a veterinarian, and always had a love for animals, and I really truly am honored by seeing all the love that these pets have been getting from their families over the years, and all the love that these pets are taking with them as they go on. I'd like to thank the CNY Business Journal for sponsoring these awards, and all of the other recipients for all their hard work and dedication they provide to the healthcare of this community. It's truly amazing that everybody cares so much.
Tonight's Healthcare Facility of Distinction Award is presented to Cayuga Health. Accepting on behalf of Cayuga Health is Dr. Martin Stallone, President and CEO.
Hello, my name is Dr. Marty Stallone, and I'm the President and CEO of Cayuga Health, centered in Tompkins and Schuyler County, New York. I'm humbled to accept the Central New York Business Journal's Healthcare Facility of Distinction Award for 2021. I'm thrilled to accept this on behalf of our community of doctors and nurses who did so much for our community and for the region during this past year. Time and time again, we asked them to do the impossible, and they rose to the challenge. Whether it was accomplishing almost 2 million tests for our population and working in partnership with public health authorities to respond to the crisis, or whether it was vaccinating well over half of our population single-handedly along with our public health department, or sending buses full of healthcare workers down to New York during the height of the pandemic to meet the need that existed at New York Presbyterian, I was deeply proud of all the doctors, nurses, and healthcare workers who rose to the challenge. I'm humbled to be among the many organizations who were contemplated for this award, but I think our teams and our people really came through, and again, I'm so proud of them. Cayuga Health is an agile organization that is partnership focused in conjunction with our community, and we deliver highest quality care, one patient at a time. On behalf of everyone at Cayuga Health, thank you so much for this wonderful recognition. Thank you.
The Heart of Healthcare Award is presented to Amanda Ray, Doctor of Family and Addiction Medicine. Dr. Ray has treated thousands of patients through the Family Medicine Clinic in Pulaski, New York, and she has assisted in the recovery of hundreds of patients struggling with addiction. According to Dr. Ray, there is no greater joy than to help a patient recover from their addiction. Please welcome Dr. Amanda Ray.
Good evening. I'm Dr. Amanda Ray. I am truly humbled to receive the Heart of Healthcare Award and quite honestly shocked that I would be chosen above so many well-deserving others. Behind every good physician is an army of healthcare workers who deserve recognition probably more than I do. My nurses, Paula Lewis and Nicole Diaz, worked incredibly hard to make sure every day went as smoothly as possible. I would like to thank Tricia Clark, Nancy Devers, Dr. Patrick Cargiuello, and Dr. Glenn Tebow for their exceptional guidance. I also want to thank my new colleagues and supervisors, Dr. Tolani Ajabe and Monica Taylor, for the opportunity to grow my passion for both addiction medicine and primary care. Special thanks to my husband Will and my family for all of their love and support, and my sister Alicia Ray for the nomination. I'm just really grateful for the opportunity to be able to help these patients, and I hope to reduce the stigma of addiction throughout healthcare. I also want to congratulate all of the other award winners. I know this is a very difficult time to be working in healthcare, and I'm sure, like me, you're working harder than ever, but it's important we keep up the fight and keep helping our patients.
Tonight, we have 2 Impact Player Awards to be presented. The first, Ryan Clapper, Director, Capacity Management and Health Informatics at St. Joseph's Health. According to Ryan, when dealing with complexity, every solution can create more problems. Acknowledge this and keep going. Those are the footprints of progress. Please welcome Ryan Clapper.
Good evening. My name is Ryan Clapper. I'm Director of Health Informatics and Capacity Management at St. Joseph's Health. And I'd like to first thank CNY Business Journal for recognizing healthcare workers, especially in the midst of the pandemic. So many have gone above and beyond the call, and this award is deeply humbling to me, especially when so many have risen above and beyond. I'd like to thank Christy Kumaletti, Anne-Marie Chiz, and David Larson, who are senior leaders at St. Joseph's, for their constant leadership and mentorship, and all of the folks that nominated me for this award. I'd like to thank my parents, Paul and Colleen Clapper, who have taught me to always rise to the call and go above and beyond. I'd also like to thank my partner, Luke, and my mother-in-law, Delilah, who have been a constant source of support over the last 18 months, and all of my family and friends who have also been so supportive in the midst of all of the chaos. Last year, at the beginning of the pandemic, I was asked to think of ways to help. An opportunity came up to be redeployed to Michigan to help during their COVID surge. I want to thank St. Mary Mercy, the 4th floor, where they were so welcoming during my redeployment. I couldn't have transitioned back into practice after 10 years of being away from the bedside without their help and without their reassurance. It was scary, but patient care always comes back, just like riding a bike. I'd also like to recognize all of the other nominees and the entire CNY healthcare community who have really pulled together to continue to provide safe and quality patient care to our patients during this pandemic. As a final thought, I'd like to encourage everyone to please get vaccinated. It truly is our one solution to the pandemic. So please suspend politics and trust just a little bit more in science, research, and our medical community that are encouraging us to please get vaccinated. It truly will be the end of the pandemic. Thank you.
Our next Impact Player Award is presented to Tom Shattinger, Senior Director of Operations at Loretto. A 16-year Loretto veteran, Tom is in many ways the man behind the curtain, responsible for keeping operations running 24/7 for a 500-plus bed facility. According to Tom, always lead with compassion, no matter what position you have. Please welcome Tom Shattinger.
Good evening. I am so privileged and honored to accept this year's Impact Player Award and thankful to the CNY Business Journal for recognizing healthcare excellence in our community. I would also like to thank the wonderful and committed team I work with every day at Loretto. Part of leading with compassion is putting others' needs first. So this award is really for all the employees at Loretto who continue to give tirelessly of themselves to provide care for our residents and the community we serve in Central New York, often sacrificing time with their own families to meet the needs of those that we care for, doing work that was and continues to be so critical during a very challenging and stressful time. It's very fulfilling to know that working hard at something you believe in, contributing to your community, and leading with passion can make such a significant positive impact. The Loretto mission speaks to being a family of exceptional people caring for and about each other. It's a privilege to have the opportunity to be part of this family and contribute each day alongside my colleagues to giving our best. A special thank you to Kim Townsend, CEO and President at Loretto, and Joelle Margry, Vice President of Skilled Nursing, for all their leadership, their encouragement, and support during the pandemic. I would also like to thank the Loretto Foundation for supporting several of my initiatives that helped improve the quality of life for both our residents and the staff during the pandemic. Thank you again so much for this award, and congratulations to all the other honorees.
Tonight's Outstanding Healthcare Executive Award is presented to Andrea Lazarick Laquay, Chief Clinical Officer of Nescentia Health. Andrea Lazarick Laquay began her nursing career over 25 years ago. Her leadership role as Chief Clinical Officer has been instrumental in developing and implementing programs that enable Nescentia Health's home and community-based system to readily anticipate and respond to the changing needs of the region's healthcare delivery system. According to Andrea, happiness is found along the way, not at the end of the road. Pursuing goals is important, but you must consciously choose to be in the moments of your life and find joy every day. Please welcome Outstanding Healthcare Executive, Andrea Lazarick Laquay.
Hi, my name is Andrea Lazarick Laquay, and I'm the Chief Clinical Officer at Nescentia Health. I'm very honored and grateful to receive this recognition, and I share it with all of the clinicians and staff at Nescentia Health who worked tirelessly throughout this entire pandemic. We're very fortunate to have the incredible community that we have. Onondaga Emergency Management was just incredible to work with, and it was really a team effort between all of us. Nescentia Health has really been in the community for over 130 years and part of the original Spanish flu pandemic that happened. So for 100 years later, to still have such a strong team that's committed to this community, it feels pretty awesome. I have been a home care nurse for over 25 years. It was my original passion. I worked in the hospital for a few years, working with patients that were in and out of the hospital, and after seeing some familiar faces, you're wondering what's happening on the outside. And that was my first toe dip into home and community-based services, and I have been in love with it ever since. Nurses don't often realize the opportunities that they have in home care. Many times you think it's just working in acute care, a doctor's office, at the hospital, at the nursing home, when in reality this offers so many more opportunities. And I have, like I said, spent the last 25 years serving our community, and it's a love. I think my one piece of advice for the world out there is to be kind. I think that's the most important thing, and to think of others. I would like to congratulate all the other winners and nominees of these recognitions. Everyone really has poured themselves into their work and serving our community.
Tonight's Outstanding Physical Therapist Award is presented to Megan Berry, physical therapist at Onondaga Physical Therapy in Baldwinsville. Dr. Berry has been part of the Onondaga PT team for the last 3 years and has shown incredible growth both as a physical therapist and as a leader. According to Dr. Berry, when you are exercising, try to focus on the things you can do rather than the things you can't do. Please welcome Megan Berry.
Good evening, everyone. My name is Dr. Megan Berry, and thank you so much for honoring me with this award tonight. Before I get into my remarks, I'd like to thank the Central New York Business Journal for putting on this wonderful event tonight and allowing so many other amazing people to be recognized. You know, I've wanted to be a physical therapist since I was in 9th grade, so saying that this award means a lot to me would honestly be an understatement. I truly feel lucky to be able to go into the clinic every day, work with patients, make them laugh, and help them feel better. It makes me feel like I make a difference in my community on a daily basis. You know, I was going through thinking about how am I going to thank all of the wonderful people that helped me get to this point, but we don't have time for all of that. So to keep it short and sweet, I'd like to say thank you to my support system, particularly my parents. You know, I wouldn't have been able to do it without you guys for always encouraging me to go for my dreams. And last but certainly not least, I'd like to thank Onondaga Physical Therapy as well as my mentor, Gabriel Briggs. The support and guidance that you guys have given me ever since I first started as a new graduate has really been instrumental in shaping me as the therapist I am today. So once again, thank you guys so much for honoring me with this award, and I look forward to many more years of being able to help people live, work, and play better. Thank you.
Tonight's Outstanding Rising Star Award is presented to Nancy Orelli. Nancy is the founder of Community Living Advocates, the Senior Care Association of Central New York. She brings senior care professionals together, both online and in person, to network and refer each other to provide the best care available for area senior citizens. According to Nancy, one tip that can change a person's life: fill out your healthcare proxy. Please welcome Nancy Orelli.
Hello, I'm Nancy Orelli with Community Living Advocates. Thank you so much for this Excellence in Healthcare Award for Outstanding Rising Star. I would like to thank Charles Harcola with Nurse Connection Staffing for my nomination and the Central New York Business Journal for awarding it to me. It is an honor. I would also like to thank the members of Community Living Advocates for supporting me and making this possible. I started Community Living Advocates in 2017 after helping my mom care for my grandma for over 3 years on comfort care. I am a registered nurse and worked over 5 years in cancer care, so I thought I knew what we were getting into, but I was mistaken. I didn't know the lingo, who to call, or where to turn. I wondered, if I'm a nurse and I'm having this much trouble, how are others caring for their older loved ones? I knew there must be a better way, so I created it. Community Living Advocates is a senior care association of Central New York. We bring together senior care professionals to network and get to know each other so they can refer each other to help care for our area seniors. We provide senior information fairs throughout Onondaga County so seniors and their caregivers can find information on services and resources that they need and want. We also have a robust events calendar for seniors. Thank you again to all the Community Living Advocates members who care for our area seniors. And thank you as well to our area healthcare workers for your care during this ongoing pandemic.
Our final category this evening is the A. John Marola Lifetime Achievement Award. Dr. Marola was the very first recipient of this special award and who it's named after. Each year, we recognize a medical professional who has made an exceptional impact in healthcare and in our community. This person is passionate and dedicated to making a difference in people's lives. Thank you, Dr. Gupta, for joining us again this year. On behalf of the entire BHG family, I want to congratulate the 2021 Lifetime Achievement Award winner, Nancy Page.
Today is a very special day for me, as it is my distinct pleasure to introduce the 2021 Lifetime Achievement Award in Medicine, given in my name by the Central New York Business Journal and Bankers Healthcare Group. This year's recipient is Nancy Page, the Chief Nursing Officer at the University Hospital at the Upstate Medical University. Nancy's achievements and awards are so voluminous, I will not be able to mention all of them in this short introduction, but I will highlight many. Nancy received her Bachelor of Nursing at Downstate Medical University and her Master's in Pediatric Nursing at the University of Rochester. Upon completing her degree, she joined the nursing staff at Upstate University Hospital, where she started in the Pediatric Intensive Care Unit, and during her 35-year career at Upstate University Hospital, Nancy took on many roles, including diabetic educator for the Children's Diabetic Program, coordinator of nursing practice, patient safety officer, director of patient safety and quality of emergency medicine, and ultimately in 2014, the chief nursing officer. She has received many academic certifications at Upstate, including areas of general nursing, pediatric nursing, education, and administration. Reading her bio is like reading who's who in Upstate University Hospital's community. So much so that when she retired in June of this year, they realized that they could not do without her, and she had been hired back on a per diem basis starting this fall. Nancy exemplifies the statement, when you need something done, give the job to the busiest person. Jack Welch, the CEO of General Electric and one of the most prominent business leaders of our time, wrote in his book, Winning, that when you need to pick a leader, they must have the 4 E's: energy, energize, edge, and execution. Nancy has all 4 E's. She has the energy to start programs from scratch, the ability to energize others. She has the edge to create successful programs, and the number one, execution, to make it all come to fruition. Without further ado, I introduce you to Nancy Page, the 2021 recipient of the A. John Marola Lifetime Achievement Award.
Good evening. I want to thank Dr. John Marola for the wonderful introduction tonight. John has been an incredible impact on the healthcare of our community, something I've known about since 1982 when my husband and I arrived here. I cannot thank Upstate enough for their impact of my career in nursing, and thank you so much to BHG for their sponsorship and the CNY Business Journal. Congratulations as well to the wonderful award honorees that are presented here tonight. I am absolutely in awe of this award. My passion with nursing started in 1981, so this is my 40th year. I have always viewed nursing as an incredible privilege. For most of our patients and families, we are not invited into their lives. We just show up, whether that's at the bedside in a pediatric intensive care unit like myself or in a doctor's office. We're privileged to be in the most personal aspects of people's lives and be the most trusted profession in the nation for now 19 years running. I just want to thank my family, my husband David, my 3 daughters, Megan, Rebecca, Samantha, son-in-law Chris, and future son-in-law Adam. Without them, I could not have done what I've been able to do in nursing. And to my colleagues at Upstate, the impact you had on my career and the impact that you continue to have on the community and young professionals is just outstanding. I very much appreciate this award. I look forward to the impact that nursing continues to have on the healthcare of the Central New York community, and certainly would welcome all new nurses coming into this incredible profession. Thank you so much for this honor tonight.
Congratulations to each winner of the 2021 Excellence in Healthcare Awards, and thank you for the impact that you make on healthcare and in our communities.
Thank you, Chris. Congratulations once again to all the honorees and the A. John Marola Lifetime Achievement recipient, Nancy Page. From all of us to all of you, thank you for your dedication to the healthcare field and have a good evening.